Dr. Candy Overholt, I want to welcome you to HealthStar Internal Medicine in Newport, Tennessee. I want to take the next week or so to introduce you to myself and all of our staff before our open house on Thursday, July the 18th from 12 to 1. And then you'll get a live tour of our new office space. So again, I'm Candy Overholt, and I trained in internal medicine at Wake Forest University Baptist Medical Center in Winston-Salem, North Carolina, and I did my medical school at the University of Tennessee. I want to tell you a little bit about internal medicine. Internal medicine, a lot of people say, well, how is that different than other doctors? And so internal medicine, we train more on inpatients. And so we train on chronic diseases. So we train in cardiology, pulmonary medicine, endocrinology, and a lot of the specialties. So instead of training an outpatient, most of our 3 years of residency is trained on people in the ICU or in the emergency room or in inpatient settings. And so we deal a lot with heart attacks and people with congestive heart failure, rheumatologic conditions like rheumatoid arthritis, lupus. We do a lot of diabetes. We start a lot of diabetic pumps. And so what I like to say is internal medicine is a lot of your chronic diseases, the diseases that happen as we age. And so a lot of internal medicine physicians go on to be specialists. Some of us do stay outpatient like I did, and others stay in the hospital. And so that's what's a little bit different about internal medicine. We still do joint injections and the things that you think about with outpatient physicians. But I did want to tell you a little bit about what's different and why this practice will be internal medicine. Another thing that's going to be different about this practice is the mid-level providers that you'll be meeting later this week. They'll be trained in specific disease states that interest them, and you'll see why as you meet them. So for instance, soon we'll be bringing on one person that will more specialize in diabetes because it's important to her, and you'll see why. And you'll see people who are trained more in autoimmune diseases because it's important to them. And so I hope you'll join us over the next week as we introduce you to the staff and why we were very specific in who we brought in. And I hope you'll continue to welcome us to this community. So far, you've been great, and we really appreciate it. Thank you.